epidemiological surveillance serves as the foundation for effective public health action. At its core, surveillance provides critical information that enables and drives action. It transforms data into insights that public health officials can act upon. There are three key purposes of epidemiological surveillance systems. First, surveillance enables early detection of disease outbreaks. By continuously monitoring health data, officials can identify unusual patterns that may indicate an emerging outbreak. Second, it helps us understand long-term disease trends, including seasonal patterns, geographic distribution, and changes in disease burden over time. Third, surveillance data guides the development and implementation of appropriate public health interventions, from vaccination campaigns to targeted control measures. Let's examine how surveillance helps us understand different patterns of disease occurrence. Surveillance systems help differentiate between endemic diseases, localized outbreaks, widespread epidemics, and global pandemics. Each pattern requires different public health responses. Surveillance data informs an evidence-based approach to public health decision-making. As shown in this evidence-based public health cycle, surveillance helps us assess community needs, quantify issues, develop clear problem statements, and evaluate our interventions. Different types of surveillance inform various epidemiologic study designs. Surveillance systems provide data for various types of epidemiologic studies, from descriptive ecological studies to analytical case control and cohort studies. This helps researchers identify risk factors and evaluate interventions. Modern surveillance systems transform raw data into actionable insights through sophisticated analysis tools and dashboards. Interactive dashboards allow public health officials to monitor key indicators in real time, enabling faster decision-making and more responsive interventions. Let's summarize the key benefits of effective surveillance systems in public health. Effective surveillance systems enable early intervention, which can prevent disease spread and save lives. They help optimize the allocation of limited public health resources. Surveillance data also provides the foundation for research and innovation in disease control strategies. To fully leverage surveillance data, understanding the transmission chain of diseases is essential, which will be covered in the next section. Passive surveillance is a fundamental method of collecting health data that relies on existing reporting systems. In passive surveillance, reporting is initiated by healthcare providers, laboratories, pharmacies, schools, and other sources who voluntarily submit data to health departments. Passive surveillance offers several benefits. It's cost-effective for routine monitoring, helps identify patterns and trends, and can cover large populations. However, it also has important limitations. A key limitation of passive surveillance is the denominator problem. While we can count reported cases, we don't know the total population affected. This makes it difficult to calculate true rates and assess the full scope of a health issue. Data collected through passive surveillance is often visualized in dashboards. These tools help health officials identify patterns, trends, and potential signals that may indicate emerging health issues. Many health conditions, such as rare diseases like spinal muscular atrophy, rely on passive surveillance for monitoring. Specialists and care providers voluntarily report cases, helping health departments track these conditions over time. Despite its limitations, passive surveillance remains a cornerstone of public health monitoring, providing valuable data that helps protect population health. Sentinel surveillance is a specialized approach that collects high-quality data from a limited number of carefully selected reporting sites. Unlike active surveillance that attempts to gather data from all facilities, Sentinel surveillance focuses on a few strategic locations. These sites are carefully selected to be representative of the population and provide high-quality data. Sentinel surveillance is particularly valuable when resources are limited, but high-quality data is essential. Rather than attempting to capture every case, this approach prioritizes gathering detailed information from representative sites. Common applications include monitoring influenza-like illnesses through a network of primary care clinics, tracking HIV prevalence at prenatal clinics, or monitoring antimicrobial resistance through selected laboratories. In Sentinel surveillance, Data flows from strategically selected reporting sites to local and state health departments, then to national health authorities like the CDC, and ultimately to international organizations like the WHO. Sentinel surveillance offers several benefits, including cost effectiveness and higher data quality. However, it also has limitations, such as potentially missing cases outside the reporting network and providing limited geographic coverage. To summarize, Sentinel surveillance is a strategic approach that balances resource constraints with the need for high-quality public health data. While it doesn't capture every case, it provides reliable information on disease trends and serves as an early warning system for emerging health threats. Syndromic surveillance is a monitoring system that detects potential disease outbreaks in real time by tracking reported symptoms. Unlike traditional surveillance that relies on laboratory-confirmed diagnoses, syndromic surveillance analyzes patterns in symptom data before diagnoses are confirmed. The key components of syndromic surveillance include collecting symptom data from various sources, automated analysis of this data, generating early warning signals, and enabling rapid response. Syndromic surveillance offers several advantages. It can detect outbreaks days or weeks earlier than traditional methods, captures data on individuals who may not seek formal medical care, and integrates multiple data sources for a comprehensive view of population health. Data for syndromic surveillance comes from various sources, including emergency department visits, primary care consultations, workplace absenteeism, pharmacy sales of symptom relief medications, and even online symptom searches. Syndromic surveillance operates as an early warning system with a structured process: continuous data collection, automated signal detection, alert generation when thresholds are exceeded, expert verification of signals, and rapid public health response. During the COVID-19 pandemic, syndromic surveillance systems tracked fever and respiratory symptoms to detect community spread before diagnostic testing was widely available, enabling earlier public health interventions. Case reporting is one of the oldest and most fundamental methods of epidemiological surveillance. In this system, healthcare providers and laboratories systematically notify public health authorities about confirmed or suspected cases of specific diseases. When a healthcare provider encounters a patient with a notifiable disease, they must complete and submit a standardized case report to public health authorities. Similarly, laboratories must report positive test results for specific pathogens, providing essential diagnostic confirmation. Case reporting has several key elements that ensure its effectiveness as a surveillance tool. It relies on standardized forms and protocols to collect consistent data across different reporting sources. Comprehensive reports include patient demographics, clinical information, relevant exposures, and laboratory findings. Reporting timeframes vary by disease severity. Some conditions require immediate notification, while others allow for weekly or monthly reporting. While electronic reporting is increasingly common, paper-based systems remain important in resource-limited settings. Let's look at an example of what a notifiable disease report might contain. This report contains critical information about a confirmed measles case, including patient identifier, dates of onset and reporting, the reporting facility, and the urgency level. Case reporting provides the foundation for disease surveillance systems worldwide. It serves as an early warning system for potential outbreaks and allows public health authorities to implement timely control measures. Vital records are official documents that track key life events and provide valuable data for epidemiological surveillance. Birth certificates are one of the most important vital records. They collect crucial data including date and location of birth, parent information, birth weight, and any complications. This information helps track birth rates, maternal health outcomes, and infant health indicators. Death certificates provide critical information about mortality patterns. They record the date and cause of death, contributing factors, demographics of the deceased, and location of death. This data helps epidemiologists track disease patterns and identify emerging health threats. Vital records follow a standardized process to ensure accuracy and consistency. This includes application submission, document verification, data validation, and certificate issuance. This standardization is crucial for reliable epidemiological data. Vital records provide essential data for epidemiological surveillance. Death certificates, for example, allowed epidemiologists to track COVID-19 mortality patterns across countries. These records enable monitoring of population growth, analysis of mortality trends, assessment of disease burden, calculation of life expectancy, and identification of health disparities. While vital records offer many advantages for epidemiological surveillance, including standardized collection methods, historical records, and legally required reporting, they also present challenges. These challenges include delayed data availability, reporting inconsistencies, and limited clinical detail. Despite these limitations, vital records remain a cornerstone of traditional data collection in epidemiology. Wastewater surveillance is an innovative approach for early pathogen detection in epidemiology. It involves collecting and analyzing sewage samples to identify and track pathogens circulating within a community. This method can detect disease presence days or even weeks before clinical cases are reported, allowing for proactive public health responses. Let's look at how wastewater surveillance works in practice. The process begins with pathogens being shed in human waste and entering the sewage system. Genetic sequencing is the key technology that makes wastewater surveillance so effective. The process involves several critical steps. First, wastewater samples are concentrated and the genetic material is extracted. Next, PCR amplification increases the amount of pathogen DNA or RNA to detectable levels. Then, next-generation sequencing technologies read the genetic code, allowing scientists to identify specific pathogens present in the sample. Finally, bioinformatic analysis helps detect variants and mutations, providing valuable information about evolving pathogens. Wastewater surveillance offers several distinct advantages for public health monitoring. It enables pre-symptomatic detection, identifying pathogens before people develop noticeable symptoms. A single wastewater sample can monitor an entire community, providing population-wide screening without individual testing. This approach is cost-effective compared to mass individual clinical testing, making it sustainable for ongoing surveillance. Most importantly, it serves as an early warning system, giving public health officials valuable time to implement interventions before outbreaks become widespread. Wastewater surveillance has proven effective in monitoring various pathogens in real-world settings. During the COVID-19 pandemic, SARS-CoV-2 RNA was detected in sewage before clinical cases were reported in many communities. Poliovirus has been identified in wastewater in regions previously considered polio-free, triggering targeted vaccination campaigns. Seasonal influenza patterns and emerging variants can be tracked through wastewater samples, helping prepare healthcare systems. The spread of antimicrobial-resistant bacteria can also be monitored, providing valuable data for combating this global health threat. Interactive dashboards transform raw epidemiological data into actionable insights through real-time visualization. During the COVID-19 pandemic, dashboards became critical tools for tracking global case counts, deaths, and trends over time. Surveillance dashboards allow epidemiologists to monitor disease spread geographically and track key metrics like confirmed cases, deaths, and recoveries. Regional health authorities use dashboards to monitor healthcare resources, track patient statistics, and analyze disease patterns within their jurisdictions. Epidemiologists collaborate to analyze these dashboards, identifying patterns and making data-driven decisions to protect public health. Effective dashboards offer real-time monitoring, integrate multiple data sources, provide customizable visualizations, and map geographic disease spread. Advanced dashboards also incorporate metrics on healthcare access, patient satisfaction, and service quality to provide a comprehensive view of public health. Demographic analysis is crucial for understanding disease impact across different age groups, helping to target interventions more effectively. Interactive dashboards accelerate outbreak detection, improve resource allocation, enhance communication, and facilitate data-driven policy decisions. Descriptive analysis is a fundamental method in epidemiology that summarizes data to characterize disease patterns. Epidemiologists use various descriptive statistics to summarize health data. These include frequency distributions, measures of central tendency like mean and median, measures of dispersion, proportions, rates, and cross-tabulations. Descriptive analysis is often visualized through dashboards like this, showing key metrics such as frequencies, totals, and trends over time. A key application of descriptive analysis is characterizing disease patterns. These patterns can be classified as acute, recurrent, chronic, or slow, based on frequency and duration of clinical signs. Descriptive analysis forms a foundational part of observational studies in epidemiology. It's the first step in understanding disease patterns before moving to more advanced analytical methods. This infographic shows descriptive analysis applied to public health workforce demographics. It summarizes key characteristics like work location, race, gender, age, and education. Such analysis helps health agencies understand their workforce composition. Descriptive analysis helps categorize disease distribution patterns as endemic, epidemic, or pandemic. This example shows how malaria risk is characterized across different regions, illustrating the power of descriptive analysis in mapping disease patterns. Descriptive analysis in epidemiology has several key applications. It helps monitor disease trends, identify high-risk populations, guide resource allocation, evaluate interventions, and generate hypotheses for more detailed analytical studies. Spatial analysis is a critical technique in epidemiology that uses geographic information systems, or GIS, to map the distribution of diseases across geographic areas. This global disease surveillance map shows hotspots of disease activity worldwide. The varying sizes and colors of the markers indicate different levels of disease severity or frequency. Spatial analysis in epidemiology consists of several key components. These include disease mapping, which visualizes disease rates across geographic regions; cluster detection, which identifies areas with unusually high rates of disease or hotspots that may require intervention; and spatial statistics, which analyze patterns and relationships between disease occurrence and geographic or environmental factors. Let's examine how hotspot analysis works in practice. This map shows heart disease mortality in the Bible Belt region of the southeastern United States. Hotspot analysis identifies statistically significant clusters of high values, shown in red, and low values, shown in blue. These patterns help public health officials target interventions to high-risk communities. Disease rate mapping uses color gradients to visualize disease rates by geographic area. This map of Illinois shows colorectal cancer incidence rates by county. These maps can overlay multiple data layers, such as mortality rates, shown by red circles, and health center locations indicated by black dots, providing deeper insights for targeted interventions. Spatial smoothing techniques are critical for reducing random fluctuations in disease data, especially for small geographic areas with few cases. This comparison shows different smoothing methods applied to the same data in Georgia. Each technique has advantages for revealing underlying patterns, from simple neighbor-based averaging to distance-weighted approaches. Spatial analysis provides numerous benefits to public health practitioners. It identifies high-risk areas that need targeted interventions. It reveals spatial patterns and relationships that would not be visible in simple tabular data. It helps monitor the effectiveness of public health programs across different geographic areas. And it improves resource allocation by directing efforts to areas with the greatest need, maximizing public health impact. Timely surveillance is critical for detecting disease outbreaks as early as possible. Early detection through surveillance dramatically changes the trajectory of an outbreak. Without early detection, cases can multiply rapidly before control measures are implemented, resulting in larger outbreaks. The benefits of early detection through timely surveillance are substantial. Early outbreak detection reduces total cases and deaths by allowing rapid implementation of control measures. It prevents healthcare systems from becoming overwhelmed by spreading cases over time. Resources can be allocated more effectively to the right places at the right time. And importantly, early detection minimizes economic and social disruption by preventing larger lockdowns. Let's examine the timeline of how surveillance leads to early detection and action. The process begins when surveillance systems detect unusual data patterns, such as clusters of similar symptoms. Next, epidemiologists rapidly analyze this data to determine if it represents a genuine threat. If confirmed, an alert is issued to healthcare providers and public health agencies. Response measures are quickly implemented, from testing to contact tracing. With proper surveillance and timely response, outbreaks can be contained before widespread transmission occurs. The success of early detection can be measured in several key metrics. With advanced surveillance systems, time to detection can be reduced from weeks to just hours. This early detection can prevent 70 to 85% of potential cases and provides a critical 3 to 5 day earlier window for implementing interventions. Timely surveillance is our first line of defense against emerging outbreaks, turning data into life-saving action. Epidemiological surveillance provides critical data that directly informs targeted public health interventions. The process of translating surveillance data into targeted interventions follows several key steps. First, surveillance data helps identify high-risk areas by tracking disease incidence, environmental factors, and population density. Next, public health officials assess population vulnerability by examining demographic data, access to healthcare, and existing health conditions. Based on this assessment, targeted control measures are designed for the specific context and disease profile. Preparedness protocols are then implemented to ensure a swift and effective response. Finally, ongoing monitoring evaluates effectiveness, allowing for adjustments to the intervention strategy as needed. During the COVID-19 pandemic, interactive dashboards provided crucial surveillance data that guided targeted interventions in hotspot areas. Targeted interventions fall into two main categories: disease-specific controls and environmental management strategies. For vector-borne diseases like malaria, surveillance identifies breeding sites, allowing for targeted elimination of mosquito habitats in high-risk communities. Surveillance data helps establish control zones for infectious disease management, similar to hazard zones used in emergency response. The hot zone contains the outbreak, the warm zone limits spread, and the cold zone houses command operations. In healthcare settings, surveillance informs targeted infection prevention protocols. These measures include personal protective equipment requirements, isolation procedures, and environmental cleaning standards based on identified risks. Targeted interventions guided by surveillance data offer several critical benefits to public health response. First, they enable optimal allocation of limited resources to the areas with highest risk and need. Second, they more effectively reduce disease transmission by focusing control measures where they'll have the greatest impact. Third, targeted approaches minimize broader economic and social disruption by limiting interventions to necessary areas. Finally, the data gathered during targeted responses enhances preparedness for future outbreaks in similar contexts. Vaccination campaigns are a critical public health response to disease outbreaks and epidemiological threats. Tracking vaccine coverage is essential for evaluating the success of these campaigns. It monitors the percentage of the population that has been vaccinated, identifies gaps in immunization programs, helps target resources effectively, and evaluates the overall success of vaccination campaigns. Global vaccination data reveals persistent inequalities in coverage. As shown in this graph of COVID-19 vaccination rates, high-income countries achieved much higher coverage than low-income countries. This inequality creates vulnerability in the global health system. Surveillance also tracks disparities within populations. This graph from England shows how vaccine uptake varied dramatically by age group. Older populations typically receive vaccines first due to prioritization strategies, but reaching younger groups often requires different approaches. Addressing vaccine inequalities requires overcoming significant logistical challenges. The cold chain shown here illustrates the complex journey vaccines take from development to delivery. Maintaining proper temperature control throughout this process is particularly challenging in remote or resource-limited areas. Surveillance data helps identify access barriers and informs innovative delivery solutions. Mobile health clinics, like this Well Mobile, bring vaccines directly to underserved communities, eliminating transportation barriers and increasing coverage in hard-to-reach populations. Ensuring equitable vaccination access has profound public health benefits. It protects our most vulnerable populations, prevents disease resurgence in undervaccinated communities, reduces the overall healthcare burden, and promotes health equity across society. Surveillance data enables precise targeting of vaccination efforts. The process begins with collecting detailed data on coverage gaps, analyzing and mapping this information to identify patterns, and then designing tailored campaigns to address specific barriers. These targeted approaches might include school-based vaccination programs, community health worker outreach in specific neighborhoods, multilingual education campaigns for immigrant communities, or transportation assistance for elderly or disabled populations. Success in vaccination campaigns is measured through several key metrics. Coverage rate tracks overall progress toward population immunity goals, typically targeting at least 90%. The equity ratio compares coverage between demographic groups, with a ratio of 0.95 or higher indicating minimal disparities. Timeliness measures whether vaccines are administered on schedule. Ultimately, surveillance-driven vaccination campaigns are essential for addressing health disparities and building resilient communities that can withstand future disease threats. In 2024, Rwanda faced a significant public health challenge, an outbreak of the deadly Marburg virus. Rwanda, a small landlocked country in East Africa, is part of the East African Integrated Disease Surveillance Network, which enhances regional collaboration for disease monitoring and response. The Rwandan Ministry of Health rapidly implemented a comprehensive surveillance system to track the Marburg outbreak. Daily updates provided transparent information on confirmed cases, recoveries, and deaths. Rwanda's successful containment was built on 5 key pillars. First, early detection through existing surveillance networks. Second, the rapid isolation of confirmed cases. Third, thorough contact tracing and monitoring. Fourth, effective public health communication campaigns. And fifth, regional coordination with other East African countries. Medical facilities across Rwanda implemented strict infection control protocols. Healthcare workers were trained to quickly identify symptoms and safely isolate suspected cases while protecting themselves from infection. Transparent communication was crucial to Rwanda's response. Regular press conferences kept the public informed about the outbreak situation and prevention measures. This transparency helped build public trust and compliance with containment protocols. Rwanda's comprehensive surveillance and response system enabled them to contain the Marburg outbreak within weeks. The limited spread demonstrated the effectiveness of their national disease surveillance infrastructure. Rwanda's success offers several valuable lessons for effective epidemic response. First, having existing surveillance systems in place provided a strong foundation for rapid action. Second, consistent data collection and reporting built clear situational awareness. Third, close coordination between surveillance and response teams was critical. And fourth, transparent public communication enhanced compliance with control measures. Rwanda's successful containment of the Marburg virus demonstrates how robust national disease surveillance systems are essential for protecting public health during outbreaks. Their experience provides a valuable model for effective epidemic response. Digital epidemiology represents a paradigm shift in surveillance, harnessing the power of digital data sources to track disease patterns and predict outbreaks in ways traditional methods cannot. Mobile phones have become powerful tools for disease surveillance. They provide data on population movements, search queries, app usage, and precise location information that can reveal travel patterns related to disease spread. Social media platforms have become valuable sources for disease surveillance. Posts from Twitter, Facebook, Reddit, and other platforms can indicate early symptoms before official reports. This enables real-time monitoring, early detection, public sentiment analysis, and geographic tracking of disease spread. Digital epidemiology offers significant advantages over traditional methods. It provides near real-time data collection from billions of global data points. These systems can capture unreported cases that would be missed by formal healthcare reporting, enabling earlier prediction and public health interventions. Digital epidemiology is already making an impact. Google search trends have helped predict flu outbreaks weeks before official reports. During COVID-19, mobile data revealed critical movement patterns during lockdowns. And in tropical regions, social media mentions have been shown to correlate with dengue fever hotspots. Despite its promise, digital epidemiology faces important challenges, including privacy concerns, data bias issues, and technical infrastructure limitations. Future directions include deeper AI integration, cross-platform data fusion approaches, and the development of global early warning systems that combine multiple digital data streams. Global collaboration represents a critical future trend in epidemiological surveillance. As diseases don't respect national borders, strengthened coordination between countries has become essential to enhance health security worldwide. International organizations like the United Nations and World Health Organization play crucial roles in coordinating global responses to health threats. These organizations facilitate cross-border initiatives and provide frameworks for countries to work together effectively. Real-time information sharing systems are becoming increasingly crucial. Emergency operations centers worldwide now connect digitally, allowing for immediate exchange of critical data. These collaborative platforms enable experts from different countries to analyze emerging threats together and coordinate responses more effectively. Standardized screening protocols represent another key aspect of global collaboration. Countries are increasingly adopting uniform methods for detecting potential health threats at borders and entry points. This standardization includes coordinated case definitions and shared training programs for frontline health workers across different nations. A powerful example of global collaboration is the exchange of medical teams between countries. During health emergencies, expert teams are deployed across borders to provide assistance and share expertise. This practice facilitates vital knowledge transfer and builds capacity in regions with limited resources. The benefits of strengthened global coordination are significant. These include faster outbreak detection and response, more efficient allocation of limited resources, enhanced surge capacity during emergencies, and more equitable access to vaccines and treatments worldwide. Looking ahead, several promising international initiatives are emerging. These include the expansion of WHO's Global Influenza Surveillance and Response System, the Global Early Warning System for Animal Diseases, the International Pathogen Surveillance Network, and new pan-regional platforms for sharing epidemic intelligence. Ultimately, strengthened global collaboration is not just beneficial, but essential for building a more resilient health security system capable of protecting populations worldwide from emerging threats.